We'll call the committee to order and ask the secretary to call the roll.
Ryan,
Here.
Parker, Barnett, Blackman, Blackwell, Blunt, Kaufman, DeBar, Fillingane, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins.
Will you show that Mr. Representative Reed is present? This time of year, you can have 3 votes if you want them. I believe we have a quorum, such as it is. I will say this to the conferees or the nominees. You may be wondering why I've called you all together. So far as I know, every single nominee is going to be confirmed, probably unanimously. But the confirmation process, particularly for major boards, gives us an opportunity to have a conversation. The various boards meet and we don't tend to be there. And then we meet and you don't tend to come sit in the legislature every day. But the confirmation process gives us an opportunity for y'all to tell us what's on the mind, what's on your minds individually, and also what you see is what's on the board's mind, as it were. And it gives us an opportunity to discuss some issues about the boards in common. So I thank you for coming. It takes me 3 hours one way to get to Jackson. And I understand there's some parts of the state that it's even longer than 3 hours, but I appreciate your coming. And I think it's important that we hear from you and hear what you have to say. Having said that, the first group of nominees is on the State Board of Medical Licensure. I know that some of you have been confirmed before, and this is a board that we have ongoing conversations with. There continue to be questions about what to do during COVID, what to do about licensing people from other states and on and on. So having said that, Dr. Loper, your name is, you're first on the list. Would you mind coming up? And I think there's a chair down there at the end. There's a microphone. On occasion, you can get the microphone to work, not consistently, but it does help if you will talk into the microphone. Thank you for coming. I know you had other places to be, other things to do, but please tell us a bit about yourself and your thoughts about the board.
My name is William Loper III. I'm from Jackson, Mississippi, practice in Ridgeland, Mississippi, family medicine. Briggs is not in here. This is how long I've been doing this. I actually started in Vicksburg practicing with Briggs's dad. So I've been doing this for 35 years. Appreciate the opportunity. Appreciate y'all nominating me. Dr. Cleveland reached out to me. So a lot of interest in medicine in Mississippi. Appreciate what all y'all do for us. So just glad to be here and glad to serve.
Were you ever a judge at the Miss Mississippi pageant?
You know, that's funny that you say that. My wife was Miss North Carolina.
Really?
Which if you would meet my wife, you would do what everyone else does. They'll go, how the heck did you get her, Loper? But
This
that's
would
another
not be
story.
the first time I've had that thought, believe me.
But-
Well, I was, Dr. Hobson once invited me to be a judge. I was a judge at the Miss Mississippi pageant. I told everyone I had been chosen for my judicial temperament. What do you see are the issues and challenges facing the Board of Medical Licensure generally? And what do you see about the state of healthcare in the state in the future, where we're headed?
Well, and let me preface this by telling you, I have no political affiliation whatsoever.
Could you,
Okay, so all this is,
could you please
I have no political affiliation
speak right into the
whatsoever.
microphone? It's
Yeah.
it's really hard to hear.
Yeah, so all this is my personal opinion. This does not come from anywhere else. So
Good.
being from here and living here my entire life, I will tell you that I think we're in a better shape medically than we get credit for. Most of the individual physicians that I deal with genuinely love being here, work as hard as they can, work like y'all work to make it as the best that we can for everyone. Granted, we have issues going forward. I will tell you this hospital situation is the real deal, in my opinion. We have got several hospitals that are in trouble financially, and when if those things close, we're going to have a real problem. I practice out of St. Dominic's in Jackson. We've already seen an increase in patient volume just because of some things that are happening. I mean, we really could overwhelm the system if we don't fix that. And quite frankly, I think any support y'all could give us, we would appreciate.
Once upon a time, there was sort of hostility from doctors from other states, even wanting to move to Mississippi and practice. I know that way back when I was first elected, which was like 40 years ago, there seemed to be an interminable length of time just to get paperwork done for some well-qualified doctor from out of the state, just get to move to Mississippi. And the executive director of the board at that time told me he didn't think it was the board's responsibility to help doctors get their paperwork in order. And I sort of thought that it was, but do you have an opinion about how that situation is going?
Well, I will tell you, I think most of us agree the way that you agree on this, that and Dr. Cleveland, our executive director, certainly agrees with that. But the time frame for that has been cut way down. I mean, honestly, if you're a legitimate physician and you want to come to our state, we want to help you come here after we do our due diligence. So I don't think that's a problem at all anymore.
Okay. Well, thank you. Do other members of the committee have questions? Senator Blackwell.
Thank you, Mr. Chairman. Dr. Looper, what's your medical practice?
Family medicine.
So I saw that you had were a physical therapist
That's correct.
before.
That's correct.
I'm curious, just your thoughts. There have been, in some states, there have been laws to allow patients to go directly to a physical therapist without having to get a referral from a physician. Having been a physical therapist and a physician now, I'd just sort of like to get your thoughts on that.
Right. I would, and again, this is just my opinion. I'm not speaking for me. I will tell you, that's probably not a good idea because medically you can get yourself in all kinds of predicaments. I was smarter when I first started doing this than I am right now because the longer I've done this, the more nervous you get about things, if you know what I mean. So I truly believe the system we have now is the right system to keep.
All right, thank you. And I'm originally from North Carolina. When was your wife?
Okay, you're okay. Now you're going to make me, let's see, 89-ish. She's from Charlotte. This is a funny story. So we met in Alabama and I went to school at Ole Miss and I said, "You've heard of Ole Miss before, hadn't you?" She said, "Yeah." She said, "Where?" And I said, "Where'd you go to school at?" She said, "Queens College." Well, I thought that was in New York. I didn't realize that was a girls' school in Charlotte. So that was off to a rough start to begin with. So, but I've recovered from that.
Yeah, I'm originally from Winston-Salem, but I was long
Great area.
long gone before
Yeah,
89.
great area.
But
Yeah.
thank you, doctor.
Thank you.
Anyone else? Thank you.
Thank you.
We appreciate your
Thank you.
coming out here and appreciate your being
Thank
willing
y'all.
to serve on the board.
Thank y'all. Thank y'all.
Dr. McClendon. Thank you for coming. And if you don't mind, if you would just sit here and visit with us a while. And again, it helps if you talk directly into the microphone, I think. But tell us a bit about yourself and your thoughts about the board.
Good afternoon, everyone. My name is David McClendon. I'm originally from Newton and graduated undergraduate from Mississippi College and then medical school from the University of Mississippi Medical Center and residency in internal medicine and pediatrics in 2008. And I was offered a great job at Singing River Hospital System. That's what got me down to the Gulf Coast. And I worked as a hospitalist, a hospital-based physician for several years, sought after leadership opportunities. And then after having 2 children, decided to open up my own practice and my own clinic. And so now almost 7 years into an outpatient private internal medicine traditional practice in Ocean Springs. I'm currently president of the licensure board. This is my second duty. And it's been one of the most valuable things that I think I've done in my career, is to be able to serve not just on this board, but also in leadership. To talk a little bit, I guess, about, certainly the COVID crisis stretched us all. It stretched the board. I don't want to go through that again. I'm sure y'all don't want to either. Telemedicine is certainly a big topic, certainly going up to at the federation level of, we're all struggling with similar things in other states. Technology is advancing so rapidly, it's hard to wrap our head around it and how that is going to be integrated in the practice of medicine. And we will struggle, I think, with that as technology continues to advance. But I'm a fervent believer that we need actively practicing mature physicians on a board making decisions about what to do with difficult situations come up with a fellow licensee. And certainly we take that duty, with great respect and honor to protect the state of Mississippi, to make sure that we're doing things properly, for the safety of our public.
I talk to people sometimes and say they've got to do something because it's the law. And, we are the law, or we make the law, whichever way it is. So since you've been on the board, are there any changes in the statutory regulations about physicians or healthcare generally that you would share with us?
Personally, a lot of these rules are at the DEA level, but the rules around pain medicine are very cumbersome for the physician who takes care of people and prescribes pain medicine and stimulant medications. And more medicines are entering the narcotic level state that weren't previously. Gabapentin, Lyrica, of course, Lunesta and Ambien have already been at that level. The most serious medicines are obviously the pain pills like Percocet, Norco, the benzodiazepine muscle relaxants like Valium. And we definitely need oversight over that. But just speaking as not a board member, but just as a physician feeling the day-to-day pressure of what it takes to take care of someone, it's cumbersome. A lot of the rules that I oversee, to a degree, it's cumbersome.
Are there state regulations that are burdensome, or do they tend to be federal regulations, or all of the above?
I'm sorry, could you repeat that?
I think I understood you to say that it is difficult for doctors to prescribe narcotics and other drugs because there's so much oversight of that, and that some of the regulations are overly burdensome, if I understood what you were saying.
And there's safety reasons why those rules are there. Of course, you have to check the PMP, that's this prescription monitoring program. You have to look at their medication list. You have to decide, they have to have 3 urine drug screens a year. That's just all the extra work. It's important, and I don't want to miss that and say that I don't think that it's important. It is. At the same time, it's cumbersome. It adds a lot of extra work when we could be performing more clinical decision-making. I spent a lot of time clicking.
Well, just as a general rule, and I don't know how to do this, but it strikes me that one thing that the Board of Medical Licensure can do is look carefully, assuming the data is there in this area and other areas about which doctors are outliers, and have some sort of closer scrutiny of the outliers. A lot of times there's an explanation of why an outlier is an outlier, but nevertheless. Do other members of the committee have questions? Senator Wiggins.
Thank you, Mr. Chairman. I'm going to take it easy on him. I just want to say how I think excellent Dr. McClendon is to be on this board. I know him to be a very smart decision maker. And as he told you, his background, he came down as open as practice. And I know I've relied on him when I had questions. And I just think I would encourage the committee, although I don't think it's in any jeopardy, Dr. McClendon, to nominate and confirm him to the position, as he's an excellent person that we want on the board. So thank you.
Well, I think he's got the votes right now.
Maybe after my speech, he doesn't, but
Senator Park.
Thank you, Senator.
Thank you, Mr. President. Thank you, Dr. McClendon, for being here. I've got one question about, in looking at the nominees here, I think you're the only reappointment, and as you stated, you're the president now of the board. I know this year there's been a lot of effort by the Board of Medical Licensure to look into the new cannabis regulations and everything that's come down. And Senator Blackwell may have some comments on this too, but are you aware that this year there was a deficit appropriation in the special funds to pay for some of your expenses regarding that?
To pay for my expenses.
For the Board of Medical Licensure to pay for, I believe, $38,000 worth of expenses in looking into the cannabis issue. Were you aware of that?
I have not been made aware of that.
Okay, so and that came to our attention earlier on in the session, and as the Medical Licensure Board goes, a lot of times our licensure boards, they have things that come up where they have to look into it, and typically what we'll do as a body here is if there is some need beyond what is called upon, usually those monies would come out of the special fund or out of your fund, because we give the spending authority for the Medical Licensure Board. And I've just, during this session, been trying to reconcile how it kind of popped up as a deficit appropriation versus additional spending authority through the board itself. And so I guess I hear from you that you weren't aware that was the case.
I was not.
Okay, thank you.
Senator Horn.
Thank you, Mr. Chairman. Dr. McClendon, have you, during your tenure on the board, seen an occasion where the board reinstated the license of a doctor who had been convicted of a felony in the past?
I do not recall. We do try to obviously take into account the totality of the licensee in front of us and what he has done to try to reconcile whatever infraction that he made. But certainly a past felony is a serious thing, but we would potentially grant a license if he had performed whatever rehab or disciplinary type measures that we had recommended. Every situation is different, but I would not hold that alone as something to keep a physician from practicing again.
So if they have led an exemplary life post-conviction and had done all the things that the board recommended that they do to make amends, there is a possibility that their license could be reinstated.
Yes.
Thank you. Thank you, Mr. Chairman.
Thank you, Dr. McClendon. We appreciate your service on the board. We appreciate your coming here to visit with us. Please keep in touch. Thank you. Dr. Dotson, if if you're willing to just come up and have a seat here at the end of the table, tell us a little bit about yourself and how you see things on the board.
Good afternoon. Thank you for the opportunity to be here. And while I am not a native Mississippian, I have spent most of my adult life practicing medicine in Mississippi. I am a native of Monroeville, Alabama. I attended the University of South Alabama and then went to Boston University for my surgery residency and the University of Texas for a fellowship in colon and rectal surgery. I practiced in Birmingham for 2 years, and then the remainder of my career was in Greenville, Mississippi, in the heart of the Delta. So, and the second part of your question was? I'm sorry.
I was just asking you to tell us a bit about your thoughts about serving on the board itself.
I think serving on the board is probably one of my greatest honors since I've been here in Mississippi. It's a way to serve the public, and it's also a way to serve my colleagues, because I think we all need sound thinking individuals on the board who can think through complex situations and problems, therefore keeping our medical staff here in the state healthy, whole, and also keeping the public safe as well.
You practice in Greenville.
I did, yes.
Tell us a bit about your practice there.
I was a colon and rectal surgeon in Greenville. I actually stopped practicing clinical surgery a year and a half ago after a back surgery. But until then, for 23 years, I practiced colon and rectal surgery in Greenville, Mississippi. At any given time, I was either the only colon and rectal surgeon in the state or one of two. Usually there was one on the coast and there was one, and I was in the Mississippi Delta, and that was always the well-kept secret that Greenville, Mississippi had one of two subspecialists in the state. So we were pretty proud of that. But that was a very rewarding time because not only was I a surgical subspecialist, I was also a general surgeon. And so therefore I took trauma call. And at the time when I first got here, we had a level 2 trauma center. And so Greenville was a hub, and that I got to see that from both the administrative end as well as the clinical end, and was able to marry the two so that you could see how systems worked. And that was very, very rewarding because, I mean, I think all surgeons get that high where you have this patient that's in extremis and you can bring them back and help them have healthy lives. I think we all get a high off of that. But mainly it's the ability to serve, the opportunity to serve, the willingness to serve, and the ability to actually get to serve.
What's it like in the medical community in Greenville these days? I'm sure there are challenges at the hospital, and I'm sure that must be having an effect on the entire medical community.
Well, Greenville, practicing medicine in Greenville has always been a challenge. It's historically a challenge. There have always been issues that are ongoing, that some of the ones we have now are not new, but they are just exacerbated by the COVID situation and then the dire straits of the hospitals that are in the Delta. I think the biggest thing is that you've seen shrinkage. That's probably the largest thing is shrinkage of services. Whereas we used to have neurosurgery services, cardiovascular surgery services, we've all shrunken that down to pretty much the basic surgeries. We still have we have cardiology, interventional cardiology, but we don't have cardiovascular surgery services there. Of course, among the physicians themselves, my husband's also a physician there. There's anxiety, you know, beyond your current anxiety about your patients, but the anxiety about the health and well-being of the hospital system itself and the hospitals, and how, and not so much self-servingly, but how you will care for your patients, and how you will get them the services that they need, and how you will be able to continue to provide the services in a manner that that meets and exceeds the standard of care. So I think there's anxiety there, but there's hope there as well. I don't think any physician in the Delta has given up on their hospitals. I think each one will fight to tooth and nail to the end to see that it happens. However, sometimes it's frustrating that I think we do our jobs too well in that we create a sense of well-being that is essentially not there because we don't want to scare our patients. We want them to have confidence in the system. We want them to be confident that they can be taken care of in our facilities. And so sometimes we're a victim of our own success because right now it's a healthy balance of sounding enough of an alarm that people stay home, use our services, believe in our services. And then the other part is that we need you to understand the gravity of the situation because people tend to get complacent because it's never happened before, therefore it will not happen this time. So there's a healthy balance and there's a fine line that you toe in order to continue public confidence, but also make the public aware.
Thank you. Questions from members of the committee? Senator Horn.
Thank you, Mr. Chairman. Dr. Dotson, good to have you here before the committee today. You talk about a lot of the challenges that you're facing in the Greenville Hospital. In your opinion, has the quality of care gone up or down over the last few years at the hospital?
I think that the quality of care has certainly stayed the same and risen because we are constantly aware of scarcity. So we do more with less because we have to. And so in that.
Excuse me, if you could speak right into the microphone, it's
Okay,
very
I'm
difficult to
sorry.
hear.
Sure.
It may help to scrunch it up a bit.
Okay. No, I think that the care has certainly stayed the same and risen because we are acutely aware of scarcity, that we have scarce resources, and we make the best possible use of those resources. I mean, you know, the old saying, you rob Peter to pay Paul. Well, we have to pay Peter and we have to pay Paul. We can't rob either one of them. And so I think that we do a whole lot more with less, and we still maintain that standard of care that we've always had. Now, does it, at what cost? It's probably our blood pressures are a little higher and our waists have expanded, but overall the care does not change.
I'll ask you the same question I asked Dr. McClendon. During your tenure on the board, have you had the occasion as a member of the board to have a doctor come before you who'd been convicted of a felony and whose license was reinstated after having made recompense?
Well, the problem with that answer is that my tenure on the board is extremely brief because I'm a new appointee. So during my brief time, I am not aware of that. And I have not gone back through the archives to see if that were the case. So, but any hearings that I've been a part of, that has not.
Are you philosophically opposed to reinstatement of a doctor who's been convicted of a felony?
I think each case is an individual case and should be treated as such. And so in entering into cases that we hear, we are encouraged not to enter with a bias. We are encouraged to take it at its face value, to do the due diligence, to learn all the aspects of the case, as well as the steps that the physician in question has taken to rehabilitate themselves if they've been given work plans to work on, rehabilitation plans, the nature of the felony. You know, all of that has to be taken into account. And I think each case is an individual case, should be examined as such. And I try very hard not to bring a bias into any case that I hear.
Thank you, Doctor. Thank you, Mr. Chairman.
Further questions? If not, thank you, Dr. Dotson. Oh, I'm sorry, Senator Fillingham.
Thank you, Mr. Chairman. And this question really could go to any of the three doctors who are kind enough to come and offer their service to the public. So thank you for what you do and for being willing to serve. My question is, since the Dobbs decision, we have a trigger law in our state that went into effect upon the Dobbs decision being handed down, which states that physicians cannot perform abortions in Mississippi except in a very few circumstances, which would include to save the life of the mother or for the exception of rape. So I'm just curious, since that hasn't been the law that long, since the enactment of the Dobbs decision, have y'all seen any of those cases come before you? Because I believe the penalty, if you violate that law, is the loss of your medical license. So I'm just curious if there's a protocol in place now that that is the law at the Board of Medical Licensure to handle those types of claims.
The answer to the first part of that is I am not aware of any of those cases, and none have come before the board since I've been there. And as I said before, my tenure has been very brief with the board. So that, that gives you a very tiny window. I think that the board and the staff members do an excellent job of doing due diligence on any case that is presented to the board. And they gather information for us. We trust them to find out all of the information that we need and to present it to us in a form that is digestible for us. And I have every confidence that if the board should have to review one of those cases, that same due diligence will be applied.
Thank you, Doctor. I appreciate it. Thank you, Mr. Chairman.
Thank you. And thank you, Dr. Dotson. We appreciate your coming to visit with us. Appreciate your serving on the board. Dr. Herzog is on the Board of Mental Health, and the Board of Mental Health has certainly had a busy time here lately. So tell us a bit about yourself and about the board.
Thank you. I appreciate the opportunity. I'm Jim Herzog. I am a native of Mason City, Iowa, the home of the Music Man, you may have heard of, but I attended Creighton University in Omaha, Nebraska for undergraduate work. And in my junior year, there was a new faculty member there who had graduated from Ole Miss the year before. And she said, you should come to Ole Miss. And I said, I've never heard of that, I'm ashamed to say. But I came here, loved the state, and graduated from the University of Mississippi with a doctorate in clinical psychology. I've worked in public mental health since 1980, served in the United States Air Force as Air Force psychologist at Keesler Air Force Base Medical Center. Worked in various 3 mental health centers across the state. I had a private practice with my wife, who was also a psychologist, and worked for the Mississippi Department of Rehabilitative Services or Disability Determination Unit. I've served on the licensure board for psychologists and been on the Board of Mental Health since 2008. The board and my tenure there has been one of constant adaptation. In 2008, we hit the recession and budget cuts and issues to have to deal with that. And I think we are still kind of reeling from the COVID epidemic, where there were shortages of people, staff, they were out sick, and people staffed did a yeoman's job of covering 2 shifts, doing extra jobs beyond what their normal jobs were. And I think in general, there's been a shift in people looking at their own careers and jobs, and I think it goes across the board, not just mental health. There's been shortages then of staff, and that's our biggest concern. And I think the department has been very creative and innovative in trying to facilitate recruitment and retention of staff, particularly direct care workers that are frontline people in trenches, trying to serve the population that it's difficult to serve sometimes. We're very grateful to the legislature for additional funding that you have done to help increase our outpatient programs, to try to expand our services. There's just been increasing demand for mental health services. And we are very appreciative of the department and trying to meet that need, which is a very difficult one. We're a very broad ranging agency that we oversee on the board that includes both the chronically mentally ill, intellectually and developmental and disabled, as well as those with substance abuse disorders. And it's a broad task to cover. And being on the board, you have to learn to deal with all these different services. And we're very proud of the agency, what they've accomplished thus far.
You know about this lawsuit?
Yes.
I've heard of that. In addition to the thrust of the lawsuit, there have been increasing interest in having more services provided in the community and fewer people institutionalized. We deliver most of our community services through the various community health centers. And so there historically has been the issue of coordination between the community health centers and the department. I didn't know what your opinion was about that situation, whether it's improving and where we're headed in that area.
Well, being on the board from 2008 to the present, there's been a tremendous improvement in the relationship between the community mental health centers, which are not funded by or supervised by the department. We'll offer some grants to them, but they are locally funded. The lines of communication have been tremendously improved with our executive directors, with current executive director Wendy Bailey. We meet with their staff, their directors, their boards, and I think that level of communication and back and forth to assist them if there's some sort of issue or crisis in the center. We've had some centers that have had financial issues and some have consolidated, and the department has helped facilitate that. And I think that then has helped the individuals for the coverage of their services. And we've been greatly improving the communication when someone is in the state hospital to get them back to the mental health center and stay on their medication and continue in treatment, which is vital. And without that communication, that's where people kind of were lost and fell through the cracks. So I think utilization of services is foremost on the department's mind. And I think there's been a 100% improvement in communication and the relationship with the departmental health, with the community mental health centers.
Questions from members of the committee? If not, thank you very much. We appreciate your service and we appreciate your coming to visit with us this afternoon.
Thank you. It's my pleasure.
We now have nominees to the Board of Nursing, and the first individual is TJ Adams. Mr. Adams, if you're willing to welcome back and tell us how things are going and any information you think we need. Oh, and please speak into the microphone. It's very hard to hear.
Good afternoon. I just want to say thank you for the opportunity. I've enjoyed being a part of the Board of Nursing for the last 4 years. My background, I grew up in a small town, Mantachie in North Mississippi. I attended junior college at Etowah Community College, nursing school at MUW, and have a master's degree from healthcare administration from UAB. Being a part of the Board of Nursing in the last 4 years has been one of a lot of learning, but also understanding the concept of our state and how we regulate. And I'll say this, that we have a very strong support and great individuals such as Phyllis Johnson and Shan Montgomery. And happy to answer any questions.
You say you're from Mantachie.
Yes, sir.
Did you know Charlie Mullenix, or was he before your time?
Before my time.
Charlie Mullenix was from Mantachie. He was sort of an after-dinner speaker of sorts and occasionally would speak to civic clubs in Tupelo. And Mr. Mullenix, I think called himself the Mantachi Flash or something to that effect, but he once told a Civic Club, I know there's some people in Tupelo that don't know where Mantachi is, but don't feel bad. There are people in Mantachi who don't know where Tupelo is, which came as a great shock to members of the Civic Club. Do other members of the committee have questions for Mr. Adams? I know that you're serving on the board now and you're a reappointee. Again, we're interested in any suggestions or comments you have about what the legislature could do or changes that you see that we need to make.
So looking at healthcare, as you're all aware, I work at North Mississippi Medical Center out of Tupelo. And we're just like every other center in the state. It's staffing shortages, whether it be nurses or support staff, and going through COVID and coming out and seeing what it looks like now. You know, it's a challenge daily to be able to staff these units with both nurses and those support staff and physicians as well. So we have to look at ways that we can produce more nurses in the state and keep them in the state of Mississippi. We do a really good job training nurses in the state. We do a really poor job of keeping them in the state. I think we're the #1 exporter of nurses in the United States. So got great nursing schools, great community colleges, great senior colleges. They get trained very well here, but we've got to figure out avenues to keep them in the rural areas of Mississippi and places such as Jackson and South Mississippi as well.
Thank you. Senator McMahon said he had a question or a comment.
Mr. Adams, thank you for being here today. I appreciate it. For this, I know some of the answers to these questions, but for the sake of the public record, I'd like to ask you, you represent the interests of Northeast Mississippi Medical Center.
Yes, sir.
Yeah. How many employees answer directly to you?
Roughly 5,200.
That's right. Is it true that North Mississippi Medical Center is the largest employer in the region with annual salary or somewhere around $600 million annually to the local economy?
Yes, sir.
Yeah. And so what would you say would be the greatest need for the hospital system, which is the 5th largest employer in the state of Mississippi and the largest employer? What's your greatest challenge, you think?
Greatest challenge right now is opening more beds. We're a 650 bed hospital system. And currently this morning, I was able to staff 252 beds.
Because you lack the credentialed personnel to fully open all of the rooms.
That's correct.
Yeah.
We were on almost every diversion as of this morning, and we're a level 2 trauma center covering the north part of the state.
I know that y'all have been very creative in your hiring practices. We recently had one of the largest furniture manufacturers in the United States file bankruptcy in our region, and I think y'all hired over 100 of those employees, and you found different tasks that did not require the credentialing or require the certifications. So that way you could take your credentialed and certified personnel and focus just on healthcare. Is that accurate?
Yes, sir.
You know, TJ, Mr. Adams, I'm sorry. Mr. Adams, I want to brag on you for a moment. You really represent the very best of Mississippi and what we're trying to do as a state. You know, I mean this sincerely. I know you're a millennial, but you know, you went to school at a local community college. Then you went on and got a bachelor's and got yourself educated, and you came back and you're contributing to the Mississippi economy, and 5,200 people work for you. And I just want you to know how much I appreciate your leadership, how much I appreciate your sincerity and the ideas that you bring to healthcare. And I hope that you find that Senator Bryan and I are good partners, because we both represent Tupelo, and I think you actually live in Senator Bryan's district, but I know you work in there that we represent. But thank you for being here. Thank you. You know, I know what a burden it is. I know you get to work 3:30, 4 o'clock in the morning, a lot of mornings, but yet you still find time to serve on the board of nursing. And I believe you're the president of the board now, correct?
That's correct.
Yeah. Thank you for being here today. I really value and appreciate what you're doing and how you're leading in North Mississippi and in this state. Thank you.
Thank you, sir.
Thank you. Anyone else? Thank you, Mr. Adams. We appreciate your coming. I'll say this, if you're not currently a resident of Senate District 7, I can get you a map. You can always relocate. Be happy to have you.
I was going to say, sir, we're neighbors. I'm just north of you in Tremont.
Thank you. Ms. Culpepper. Would you tell us a little bit about yourself and your opinion of the Board of Nursing so far?
So I'm Sandra Culpepper. I'm from Poplarville, Mississippi. I have been a nurse for 16 years. I've worked in just about every area of nursing you can possibly work in. I am an LPN, and I have served on the Board of Nursing for 6 years with my final reappointment being this one. And I can say that being a part of the Board of Nursing has been one of the best experiences I've ever had. It's been an honor and a privilege to work with a group of people that even if we don't always agree, we can find common ground and to meet the needs that we have at the Board of Nursing, because we know that the last couple of years it's been very difficult for all of us. And so for me, I've never worked with a more phenomenal group of people at the Board of Nursing, from staff to board members.
Thank you. Do members of the committee have questions? If not, are there any suggestions you have for us about the shortage of nurses, how to address that?
I do. I have the privilege of chairing ONW at the Board of Nursing. But I also have the privilege of, I work for Forest Health as a nurse recruiter, but I'm also a nurse aide educator. And what I'm seeing is, I know that within the next 10 to 15 years, I'm going to be up for retirement. We do not have enough nurses in the education system now. From nurses in the field to nurse educators, there's a serious issue. And I know that we're about to leave, over the next 10 years, you're going to lose a lot of seasoned nurses to retirement. We need new nurses in there with us now to learn, because it's like I've told my students, these guys behind me, I'm not going to live forever. None of us are. But what I do know is I have to leave something behind for these nurses that are going to take care of the future for us. And so for me, my biggest concern is we need more nurses. We need more nurse educators, because like Mr. Adams said, they can't get enough nurses. I know at Forest Health, we don't have enough nurses. The educators are telling us we don't have enough nurse educators to add more nursing students to our rosters. And so the only way to fix it is we've got to work on the educators, then add the nursing students to the equation, and let's fill the gap.
Thank you.
You're welcome.
We appreciate your service. We appreciate your coming to visit with us. Thank you. Ms. Tigert, I'm sorry, Ms. Walker. Thank you. And if you would just come tell us a bit about yourself and your experience on the Board of Nursing and other information you think we need.
Carly Walker, and I grew up in Northeast Mississippi in Boonville, and started my first job actually at North Mississippi Medical Center when there were 700 employees, a long time ago. I've worked in various different fields of nursing. I've worked in med-surg floors on the hospital. I've worked in the surgery department. I've worked the last 30 plus years in a facial plastic office. I am new to the Board of Nursing, but I could not be more honored to work with a better group of people. I have a lot to learn, and I look forward to serving the people of the state of Mississippi.
Do you have any insights or suggestions based on your service on the Board of Nursing about either the board or the state of nursing generally?
I think there's some things that could be looked at as far as retention of nurses. We do certainly lose a lot of people. But since I'm a new girl on the block, I'm going to sit back and listen a little bit before I give my opinion.
Thank you. Do other members have questions? If not, thank you. Thank you for coming. We appreciate your willingness to serve. Ms. Clanton? Welcome back. It's good to see you again. If you don't mind, tell us how things are going on the board and any information you think we need.
Good afternoon. I'm Janie Clanton. Everything on the board is, to me, is going great. We have a good group of people to work with. We like to kind of, any idea that I bring is not too crazy. Everybody listens to our ideas. And like others have said before us, we know we have problems with retention, problems recruiting. And I think that we've all taken a look at it and we're really take to heart what's going on. Everyone at nursing, healthcare, the citizens of the state of Mississippi is our passion to serve them to the best of our abilities. And we do recognize that we need to have the people in place in order to take care of our community. And that's what it boils down to, is us taking care of our community. So like I said, they're a great group of people. I couldn't ask for better people to work with. They've made me feel welcome. And like I said, you know, we all, and it's no different from us, from the nursing board to the medical board to, you know, just general contractors trying to find plumbers, electricians. We're all kind of, you hear the same story over and over again. It's just you put in the different profession. We're all lacking for the qualified people. And that's what we know, that we've tracing it back down. Like for me, I'm actually a flight nurse and a flight paramedic. I run an air base in Natchez, and we have the same problems trying to fill the gaps. And what we're doing is, you know, we can't put a traditional solution to a new problem. And so we think outside the box, and that's something that we've been talking about in the nursing area too, on the nursing board, is let's think outside the box. We're not fixing it the way we normally fix something, and think outside the box and try to figure out what we can do to solve or help to contribute to the solution of the problem that we're having.
Thank you. Do members have questions? If not, thank you very much. We appreciate you coming back to visit with us again. We appreciate your service.
Thank you.
At this point, we have heard from all the people who are present today. You will notice there is on the agenda another group of individuals who are not present. I have had a subcommittee chaired by Senator Parker look over those names, and I think that the names that are before you are those that Senator Parker's subcommittee looked at and found to be in compliance with the statutory terms, and they did not raise any questions about those. What I propose to do is at this moment give members of the committee an opportunity to look at the stack of nominations, which I assume you have. And if any of you have questions about those or need for us to get additional information, you could just say so now. We're going to meet again in the morning, so we can set things aside and come back if we need to. And while the committee is doing that, again, I want to thank those of you who came down here to visit with us today. And I want to thank you for your service on these boards. I hope that it helps for all of us to have these conversations. And I think all of us, each of us, would be happy to hear from you at any time. Pick up the phone and call. Tell us if you've got information you think we need to know about. We're always interested in hearing. I've said till I'm blue in the face, I'm not an expert on healthcare. All I did was win an election. But I know enough about healthcare to know that those of you who are out there in the field have insights that all of us need. For better or worse, we're the folks that form a lot of policy, and it's helpful to us to hear from you. So thank you. Do members of the committee have any questions about this other group of nominees? If not, I think Senator Parker has moved that we take up all the nominations in block. Is there any objection to that? Seeing none, Senator Parker moves that we do advise and consent on each nominee. Questions, debate, you ready to vote? All in favor, aye. All opposed, no. The ayes appear to have it. The ayes have it. Thank you. We'll report this to the full Senate. And thanks to the committee members for coming here, Senator Blackwell.
Yes, Mr. Chairman, could you check Senator Parker's microphone to see if it's on? I didn't hear him make those motions.
The acoustics in here are just not good.
Ventriloquist.